We have a unique setup for today. We're going to do one slide, and then we're going to do a panel discussion. So I'll just start by saying when I came to quality 4 years ago at Baxter, I was assessing the talent, and what I found out was I had a bunch of history and English majors who fell into quality because they had nowhere else to go. And I was like, wow. And so when we started brainstorming with Jeff and Cisco and everybody a year or so ago, in my mind it was like, why isn't there a quality major in universities? It seems like it's such a massive field. I can't believe that nobody studies it. So, and that major doesn't seem to exist because I've never come across one.
Yeah, there are.
There are now.
Yes,
so yes.
Purdue has started a Polytechnic Institute.
So you'll hear more. We've found some along the way, but they're few and far between. And so that's part of where, at least on the MDIC side, this work stream was born. And so I'll talk. We have a pretty broad group that works on this. We have lots of volunteers, lots of passion around this particular subject. And we were lucky to partner with Marla and her group. And so we formed a partnership that's really moving this ahead quickly. So in general, we broke this into 4 phases: plan, accelerate, pilot, and achieve. And so in the planning stage, the first thing that we did, to your point, was go assess, are there any quality programs out there? And if so, where are they? So we did an inventory of quality programs, and I want to say we found about 6. And then to reach out to universities and offer to partner with them, create a framework for the curriculum, and eventually pilot. That was our plan. So we hooked up with Marla and started working to accelerate the pathway for patient health process, which has several elements, but one is, what are the key focus areas for a quality program? What would we want to see? And I think it's safe to say, and I won't cut to the chase too fast, but I think there's a benefit to having a science or technical background along with a quality minor or co-major. How rigorous should the program be? What's the curriculum? And what are the success factors for somebody that we would want in this program? The ability to think outside the box, connecting dots, things like that. So we put together all of that framework. At this point, Xavier and Marla's group is going to pilot a course in the fall of 2019, so that's coming up very quickly. And then as a team, we also talked about, since this is important to us as an industry, we should be offering internships for these students so that they get some practical experience as part of their curriculum. And we certainly have the ability to do that. And then we said, how are we going to fund this? This is a new program. We're asking universities to do it. It's going to cost money. How can we make that less painful for the universities? And so we talked about each of us will offer up, volunteer some of our SMEs in different technical fields to teach the courses. And then obviously we want to know what are going to be the success factors for everybody who's involved. So for industry, it will be that we start getting qualified candidates coming in with quality knowledge. For students, obviously, it's that they have job placement relatively easily. And so that's an important part of what we're looking at. We still have things to do, obviously, to get this program fully up and running. But at the end, our hope is to establish a quality discipline at the university level and to educate students on the benefit of making quality part of their future career ambition. So that's where we're at. We've made a ton of progress, and at this point I'm going to turn it over to Adrian, and we're going to do a panel discussion with Marla and myself.
Fantastic. You want to sit, relax? We're the brightest people in the room. I just noticed all three of us. It's summer, folks. So thanks, Jackie, for the great introduction. And I do want to echo Jackie's point about the representation on the team has been fantastic, from not only industry and academia and people that feel strong about quality and people that feel strong about training, and the momentum that's been accomplished in the last few months. So before we start our panel today, and for those of you who don't know, Jackie is the Chief Quality Officer at Baxter, and Marla will talk to us specifically about her initiative at Xavier, and so you're going to get two different perspectives in this conversation. So Jackie, before we start, can you tell us about your collegiate experience and how that got you to quality?
Which one? So my undergrad I had two undergrad majors, one in biology and one in medicine. And then went to work in a hospital. I was a med tech in a clinical chemist laboratory. While I was there, I went back and got an MBA, and then decided I wanted to do research. So I went to Baxter, still as a med tech, but in the preclinical organization. And then decided I really needed more science knowledge. So I went back to school and got a master's in toxicology from the University of Florida Vet School. And then decided I really needed a PhD. So I went back to school again and got a PhD in neuroscience from UIC Med School. So I'm a never-ending student. My husband has threatened to divorce me if I say I'm going back for one more thing. But I really just couldn't get enough knowledge. I felt like I needed more and I needed more and I needed more. So that's kind of, now how I got to quality, I always say I got lost on a highway one day or someone was punishing me, one or the other. I was in R&D for 20 years, ran the preclinical organization for Baxter, and then decided there was no further I could go in R&D anytime soon, so I decided I should use my MBA, and I self-nommed into international marketing. And I was doing that, having a great time. I did figure out that marketing has a much better life than either quality or R&D. Certainly a bigger budget. I was in India and China for that year, and then Baxter got in some challenges with quality, and they asked me to come out of marketing and become head of compliance. So I did that, and then about a year and a half after that, we got a new CEO, and he cleaned house, and he moved me into head of quality. And some of you in the room know exactly what I'm talking about. Cleaning house is like a weekly endeavor. So you may not see me again, but it's been nice knowing you. That's it. Thank you for sharing. And Marla?
My background or how did I get into quality? So I actually went to Xavier University as a freshman, I think 30 years ago. Got my degree in chemistry, got my PhD from University of North Carolina in organic chemistry. Merck happened to do some on-campus recruiting at UNC, but I was going to Procter & Gamble. I mean, you were so brainwashed by P&G in Cincinnati. And my research advisor kept saying, what are you talking about? This is Merck. I'm like, I know, but that's P&G. So fortunately, the P&G job got frozen and they couldn't hire, so I had to go to Merck. But it turned out to be the best experience ever. I absolutely loved everything I did. I became head of quality for the North Carolina facility for Merck. I stopped working for Merck when I had my first son, wanted to raise my kids. In the meantime, we moved back to Cincinnati. I walked on campus and said, you need to link the chemistry department to the outside world. Again, knowing that so many people come into our industry and don't know anything about it. And they said, okay, do it. I said, well, I'm not looking for a job, but thank you. But then a year later, in 2008, I started what is Xavier Health. And everything we do is with and for industry and FDA. So we bring industry together and we look at what can we do together to address the challenges. So it's in that role that we really came on that we need to look at developing this next generation of quality professionals.
Thanks, Marla. Just to give you some perspective of where folks have come from. So Marla, can you describe the areas that you are advancing at Xavier Health with the Quality Science Education Program?
So I'm here under a different hat. I know it says Xavier University, but I started my own company in the last summer called Pathway for Patient Health, because what I'm going to talk to you about wouldn't make any sense for me to be doing out of Xavier. So I started that company so I could do things more globally. And one is looking at developing a curriculum that any university in the world can adopt. So it would be kind of odd if I was doing that out of Xavier. So this allows me to do things like that. The reason I did is there were 5 different companies who approached me in 2017 from all over the world, just happened one summer to say, can we hire your students? I said, why? And they assumed that because of what I'm doing at Xavier Health, we had students who were getting their education in quality. I said, we actually don't have any of those programs here. And after the 5th one, I said, you know what? Let's make this happen. So then I started my own company. We developed this program. We had a focus group session that included a lot of industry people, got a lot of input. And then also through Pathway for Patient Health, I lead a group of chief quality officers. So Peter Shearstone, who you heard from earlier, is on that team. Boston Scientific, Abbott, I've drawn a blank, all of a sudden, P&G, AstraZeneca, and so on. So yeah, exactly. So through those chief quality officers, we looked at the quality science education as well, and they fully endorsed it to this is the level you're describing of, we need to be able to provide these subject matter experts to teach. We need to be able to provide paid internships. And so it's through this is something I realized sitting back there's no way you can see any of this, but it's brilliant. One of the chief quality officers told me that the transformation map is all the rage. So I created a transformation map, and anything shaded is what we've done already. But we looked at what are we measuring cross-functionally, so we have an understanding of what's going on with our cross-functional peers, because quality is heavily criticized that we don't understand the business and we don't understand our cross-functional peers. So similar to an earlier comment, if we look at what are those cross-functional peers measuring, it would give us an idea of what's important to them. But now the next stage is these chief quality officers are bringing in their cross-functional peers to the team to formally join us. We formed a quality role team of the people below the chief quality officers who looked at what is the ideal state for what the role of quality could be instead of the police. And so instead of having to approve and review and audit, like what can we do to enable enterprise-wide quality effectiveness? And that's when we said, if we're looking at this, we need to create that next generation of quality professionals. So that's where we got into the quality science education. So it's kind of like all of this together is what we're doing to make it happen. And I think that's why in the past, a company might have tried this with a university, or an industry group might have tried it, but it's really this whole huge collection of activities, the holistic approach that can make it happen.
Can you talk about funding for the program?
Yep, so funding for the program, we want it to be free for the universities. So we mentioned Xavier University is going to pilot it in the fall. We have other universities, we're holding monthly virtual info sessions. And so I'm going to name some universities. It does not mean they're going to participate. It doesn't mean they endorse it. They were just interested enough to learn more. But just to give you an idea, so we had like Georgia Tech and LaSalle and University of North Carolina and University of Kentucky and University of Dayton. And so there's a bunch of schools. We also have Novo Nordisk in Denmark working with the Danish Association because they want the Denmark schools involved. We have Brian Schultz from Fisher & Paykel on our Chief Quality Officer team who wants the University of Auckland involved. So it's not a Cincinnati thing, it's not United States. So in order for this to be free, part of it is to have subject matter experts to teach. They can teach on campus, they can teach online live, they can teach on demand. And then the way that we're going to get the funding to help support the salaries needed to make all this happen is we're creating a software platform that will link companies to all these students all over the world. So imagine Brian Schultz in New Zealand. He can't get anyone other than local talent pool. I mean, people don't even know they exist. It's so far away from home. But if we have this pool of all the students who are participating and check off as they take each of these classes that we said we want as part of this minor, and ask them where in the world would you be willing to live and work? And if they said New Zealand, I mean, I know a lot of students who would.
I would.
I know. I think we need to have like an industry exchange program, right? But I think Brian would be really surprised how many students would love this opportunity. And there's no way he would know they're even out there. So it's like a matchmaking service basically to link them. So for each company to have access to these students each year, it'd be like a membership fee. And it's based on company size, and it's honestly not that outrageous. It's like $5,000 for a small company. For a large enterprise-wide company like Peter's got 195 sites all over the world, they can hire 200 people out of it each year if they want. It's $75,000. So but that money can help us. We already have 4 people working in our company doing this without the funding yet. Some of those companies are providing seed funding though for us.
Can you talk about how this is mobilizing that CQO mission from an enterprise-wide perspective? And then I'm going to ask Jackie to comment about quality discipline within other functions in enterprise.
Great. Yeah. So how is this education going to help us achieve the Chief Quality Officer Forum mission of mobilizing enterprise-wide quality effectiveness? One is the courses that were identified. Again, not again, but when we started this, we were originally thinking a quality science major. And one of our chief quality officers said, I still need them to be scientists first, not just a quality major. So that was like eye-opening, like, duh, yeah, that's right, we do. So we want them to be chemists, biologists, engineers, data scientists, polymer scientists, whatever they need to be to be functioning in those companies, and then have this as a minor. So when we started off thinking it was a major, we had a lot of different classes identified that we wanted them to take. And then when we needed to whittle it down to a minor that a student could take, and then also we took into account that some of them are 18 through 2021. Are they really ready to talk about the culture? Like they don't even know what the workforce or workplace environment is, let alone the culture. So we had to add in reality. So the courses are regulatory and legal framework, understanding the why behind our regulations. So why are they in place? Not what are they? What? And that's the prerequisite for taking the other 2 industry-related courses. And those are like product development, specifications, validation, verification. And then the other one is risk and failure analysis, which we want them to take while on internship. So they see it in reality. Chances are if they're with your company for a summer, they might see a failure. So they could see how it's actually investigated and what data needs to support your conclusions and things like that. So then the other 2 courses that are not necessarily industry related are one related to business acumen, because again, we got heavy feedback, which created our problem statement that quality doesn't get the business. We don't understand it. I will say that I am finding that other cross-functional groups don't either, but that's okay. So we'll stick with, working on ourselves. And then the other one is a non-major science. So if I'm a chemist at Xavier, if I take microbiology, that would be great. If I'm at a school that has engineering, great. If I'm still at UNC, we had a big polymer focus, great. So something that's not your major to give you an interdisciplinary science. So now the neat thing is that these students will go into your company somewhere, not just quality. And in some companies, they will not hire into quality fresh out of school. You have to get experience first. So you're going to have these scientists all over your enterprise, and they understand quality. So now you just organically are creating this quality ownership across your enterprise.
Great, thanks, Marla. And that's my Jackie, from an enterprise perspective and coming from industry, how does that sound or resonate when you think about folks coming into the organization in cross-functional roles that have a quality mindset?
Yeah, so as many of you know, on the corporate side, typically when you say quality, everybody grimaces and they say, oh, you just cost us money and time all the time. That's it. You basically bring nothing but problems to our attention. And so quality is a cross-functional group that really touches every part of the business. We get complaints that come in, and what do we do with them? We work with R&D to redesign a product to make it better and address a customer complaint. We obviously work in manufacturing and try and keep conversion loss down and try to make sure the product going out the door is what it should be. We work with, and probably the most challenging one is the sales and marketing teams who, again, tend to think that quality is just holding up launches and costing money, but actually the spin on that really is if you don't have it, it costs you a fortune. And as soon as you can get that mindset embedded on the business side, things work a lot better. So I would argue that and I get questioned. My quality organization is 5,500 people. And all the time I get feedback, you know, that's way too much of a percent of the company, too many people, blah, 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 blah. And it really isn't. It's actually, I think it should be bigger than it is, but that's, of course, the quality perspective. It's touching everything and interfacing with everyone. And so exactly to what Marla was saying, it's critical to the success of our mission in the end, which is saving and sustaining patient lives. And without quality, you don't have a product. So yeah, it's huge.
Thank you for the feedback. I'm going to do one more question for each of them and then open it up to the audience for questions. My question for Marla is going to be, how are universities responding to this? My question to Jackie is, where do you see this being able to be leveraged by the FDA, and how we may be able to share talent with internships and get them ready for either FDA or industry-related roles?
I'll go first.
She's like, so I can remember the question.
So I can be done. So, you know, obviously our relationship with the FDA, drugs, devices, biologics, in all avenues is really important. And understanding, when I first came to quality, the biggest problem that we had was we didn't know how to interact with regulators in a collaborative way. It was always a fight. It was always, they're wrong, we're right. We've done it this way forever, blah, 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 blah. And so it's really, really important that you start to understand that we're both working for the same endpoint, which is patient safety. And once you can wrap your brain around that, it becomes much easier to collaborate. So I think, you know, part of this program, the way we're designing it, is also with a potential internship to the FDA, just to see that side of it, because that's a really, really important side of it. It's almost a, you know, unique perspective relative to the rest of us. So that will be a critical component of the program that we're putting together.
Yeah, as far as universities, they are so excited. I mean, it's just really neat. One thing I found even at Xavier is they don't know our industry. Like Peter was saying this morning, they don't even know we exist. And then they have no idea what your career could be. They think you need to go into a lab. The students think the same thing. So you have some seniors who realize, you know what, I'm not going to med school. I don't really know what I want to do. I don't want to go to grad school. And you can just see the weight of the world on their shoulders. Like, this next decision I'm making is for the rest of my life. I'm going to be in lab. Do I want to be in lab for the rest of my life? And I'm like, yeah, that's not the way that works. And we start talking about the careers. And being from pharma myself, I was fascinated to find that medical devices, a salesperson is teaching the surgeons how to use the device and is in the OR. So if you imagine you have a student who wanted to go into med school but decided that wasn't for them, this could actually be a career that could really still tap into that passion they have. So on our website, we actually have a page for students, and we start listing some of these careers, and we're going to have little web blurbs of people talking about their careers to give them an idea of what you could go into. And we really talk about all the science, like you were saying, everything quality does, you're supporting the science and the data that's needed. So you really have to be a true scientist to get into this industry. And then the universities are finding the same thing. The faculty don't know how to advise the students into our industry. So the reaction has just been, wow, this is really cool. Some of the schools are starting some of their own programs where it is just obvious this could support everything they're trying to do. And then others maybe have the master's program. I think there's some schools out there that have masters in quality but don't have the undergraduate. So this could be a feeder pool into those programs. The last thing I'll mention is, I'll mention two more things. They're still shocked that it's free. Somebody said, do I need to sign a memorandum of understanding? I'm like, no, we just want to give it to you. Here's the curriculum, here's the content, we'll give you the people, we have internships, we have mentors. We just want to give it to you. So they're still shocked by that. I think the other thing too is that from a university standpoint, they're excited for the potential of the students, and they want to package it as a minor. From an industry perspective, we don't care what they call it as long as they take these classes. We'll just check off yes, they had it. But for a university to package it as a minor, they can. It gives the student an idea that they're heading towards something with this, and then it's also something that faculty can talk to with potential parents. Like, your child can enter this program, and this is where it leads. So overall, very, very positive.
I do think that's a really important point, that marketing the potential opportunities that come from this is really, really critical. Because when I think about our quality system, we have 21 different quality system elements, CAPAs, complaints, on and on and on, supplier quality. And I don't think anybody's aware of any of it.
Good perspective.
All right, actually, one of these mics.
So Marla, I've worked with a university to try to set up a very similar program several years ago. One of the major hurdles that we got into, this was a state school, was the certification of the curriculum, the programs themselves, and definitely from a funding perspective, being a state school. How have you addressed that in the sort of establishment of this program?
Yeah, so there are several hurdles that the universities have to overcome. Fortunately, being at Xavier, I've been working with them for a year and a half, and we're sharing with the other universities how they've come up with some workarounds. One of them is certification. For them to keep their accreditation, I believe most schools have to have, the person teaching has to have a degree higher than who they are teaching. In the case that we're doing for Xavier in the fall, I think one of the 3 faculty members in this program will have a degree higher, but not the other 2. So Dr. Barbara Hopkins, who is chair of the chemistry department, is basically the one who is leading that course, and she has guest lecturers who happen to be our 3 subject matter experts. So we shared that as an example. Another example is how long it takes for them to get a minor approved. So if we waited for that, Xavier would not be starting in the fall. Xavier can start what they call experimental classes, and as long as they get 8 students signed up, they can have a class. They've got 20-some students who signed up for this stuff, so very positive. University of Dayton shared that they can do an undergraduate certificate program very easily, so they're going to get that going. And in Xavier's case, while the experimental class is going, they're going to go through the steps to get the minor approved. So there's a lot of different hurdles, but we're sharing with all the schools how each one of them is overcoming them.
Is it still 2 to 3 years to get the minor approved? Is what you're hearing on average?
It depends on the school. At Xavier, they can do it in a year, but there's no way we could start in the fall.
Yeah.
So even that's too long.
So mine is not a question, more of a comment and a very short story. So I used my son, as a matter of fact, as a guinea pig. He graduated from Loyola, Chicago, as a business major in finance. And of course, when he graduated, he wants to be a financial business manager. Well, it doesn't work that way. So I got him into testing and validation. And guess what? He works now for United Airlines. He's been there for 4 years, and he does the system analysis. So really what got me to think, since now we're in consulting, we decided to go and recruit students. Many students graduate after 4 years. They have no clue what to do next. And we started setting up literally meeting with these kids, interviews after interviews, explaining to them that we work in validation, computer system validation. We convinced them what it is, and we told them about the financial benefit of it, what they can make when they graduate, instead of waiting on tables or working somewhere, which they could have done pretty early in their life, right? And we set up a 30 days training boot camp for these kids. And guess what? Many of these kids, as we speak today, they're making close to 6 figures. Just because, and they're actually recruiting their friends now to come in and work. Because we came to the point where we're running out of resources, and they don't understand that type of business. Validation, schmalidation, what is this? Testing, what do you mean? What do you do with that? So as you teach them that. So really, my story is thanking you for what you're doing. It's unbelievably beautiful, because a lot of kids don't understand this business at all. And there's a great opportunity. Thank you.
Thanks, Tom.
A quick question to Marla and Jackie. Are you already teaming up with organizations like Junior Achievement to spread awareness on quality careers?
So we're not yet. One of the things we even talked about is going to conferences where universities go. So that we're. And the other thing we've done is we're actually making calls to all of the universities, like personal calls to universities, we're at Xavier, so I'll put this hat on for a second. We have industry conferences, and so we had between our March and May conference, we had 550 people with us, and so we reached out to them and said, "Would your alma mater be interested?" So they're reaching out, and we're getting those people connected. That's how I forgot to mention Alcorn State is one, because someone recognized that's a school where they are located. Would be a great opportunity. But then, in addition to that, we're looking the next step once we get this going would be to reach back down into the high schools now and go that route. So.
Thank you.
Awesome.
May I comment? Marla, thank you for doing the work. It's almost like foundational building. My opinion is that quality should be a graduate program. We should offer master and PhDs in quality rather than a BS in quality. If we do all offer a BS in quality, we really need internship. Because all of us are quality professionals. You know that we cannot do our job without leadership skills, without influencing skills. A lot of what we do is really, we don't have direct responsibility or direct control. So we do a lot of work through what I call relational, the EQ. Okay. So really BS level is really probably too low in my mind for this professional. And we pay a lot for quality, right? If you look at HR, they say that quality commands the highest salary, when you look at an operating site. So.
Really?
Yeah. So I would agree, and that's why we backed down from the bachelor's degree. I think a bachelor's degree in quality would not be the right approach. So taking a scientist, so a chemistry major, and giving them this minor in quality so they understand the why behind it, risk and failure analysis, how to think critically, and to be curious. So that's what we're focusing on for the undergraduates. What we've been told from not just the Chief Quality Officer Forum, but a broader survey that we did across the industry is that this would shave 1 to 3 years off of onboarding training for these students to understand our industry. So, but then the graduate program, when you get to that point with the master's, that's when you get into even project management, influencing without authority, culture, those kinds of things.
So as an industry member participant here, what are the next things I can do to help support this effort?
Okay, so we are looking for industry who has paid internships, because when we build this portal, we want the students to be able to have access to paid internships and those opportunities. And the Quality as a Career team has been putting together what would an internship opportunity look like. So it's kind of more harmonized. And then subject matter experts to help teach, mentors. We're going to be doing a call for mentorship. So all kinds of people.
So we're almost at our 30 minutes. So I'm going to go ahead and pause where we are. We're going to have some open time this afternoon where we break out into groups and certainly can take more of your feedback or questions to help us with the pathway as we go forward. But I want to take a moment and recognize Jackie as co-sponsor of this initiative, and thank you for your industry perspective today. And certainly Marla Phillips, we are so glad we made that phone call not too long ago to understand what work you were doing in the effort for the CQO Forum
And Adrian,
Pathway Patient Health.
my co-sponsor. Thank you.
Thank you.